For all things health and fitness, this is the Army Gymnastics Podcast.
The Army Gymnastics Podcast.
Discover a fitter, healthier you at armygymnastics.com.
Hey there, I'm Kate. Welcome to it. Today on the podcast, we're going to take a look at type 1 diabetes and is a cure possible? Now, type 1 diabetes is managed through a treatment of symptoms, and as of 2019, 1.6 million Americans were living with type 1 diabetes. Type 1 diabetes in particular has proved to be a puzzle for medical experts. Though its symptoms appear similar to the more common type 2 diabetes, the two diseases are very different. Type 1 diabetes almost always manifests in adolescence, but researchers have yet to isolate a definitive cause. Though you may hear rumblings from time to time that there could be a cure for type 1 diabetes, is this really possible? To find out, let's take a closer look at what makes this illness unique, and in doing so, examine some of those unique qualities and see why they may be a cause for hope. First up, let's take a look at how type 1 diabetes is different from type 2 diabetes. Now, the warning signs of both type 1 and type 2 diabetes are similar. People are at greater risk of infections, they experience frequent urination and increased thirst and appetite, amongst other things. Sexual dysfunction is one of the classic signs of diabetes in men. The cause is the damage that long-term high blood sugar can do to blood vessels. And signs of diabetes in women may include new or worsening emotional health problems. Research has been done between depression and diabetes in women, and there is a link on armygymnastics.com if you want to find out more about that. But these warning signs are more or less equally present in cases of type 1 and type 2 diabetes. However, their root causes are very different. Type 2 diabetes is usually considered an acquired illness. Obesity and lack of exercise cause long-term high blood sugar. This forces the body to produce more insulin to manage it. Over time, the body loses sensitivity to insulin, so the treatment is to try and encourage lifestyle changes to reduce insulin insensitivity. Doctors may also prescribe medications like Ozempic to help manage the condition. Now, type 1 diabetes, on the other hand, is thought to be an autoimmune disease. And for reasons that are not very clear, the body attacks its own pancreatic cells, and over time, this causes the loss of your ability to produce insulin altogether. And treatment usually requires administering artificial insulin. So, will there ever be a cure for type 1 diabetes? The short answer is there is no cure for type 1 diabetes right now. However, we may be very close to a functional cure. Because type 1 diabetes is caused by the failure of the pancreas to produce insulin, researchers are hopeful that a biological cure is possible. Now, a biological cure would mean treatment that would help the body produce insulin on its own again. And if successful, these treatments would restore blood sugar to normal levels without complications or the need for supplementary medication like artificial insulin. Now, research has centered on what's called islet transplantation. Now, islets are the clusters of cells in the pancreas that are responsible for producing insulin. And when they fail, you see the symptoms we associate with diabetes. Islet transplantation would take the healthy islets from organ donors and inject them into a diabetes patient. Now, so far, early results in studies have been positive. Several studies have produced people who either reduced their reliance on insulin injections or were able to stop taking it altogether. So following along the same lines, emerging research shows that stem cell therapy may also have the potential to produce a functional cure. Last year, researchers claimed to have functionally cured a patient by coaching stem cells to become healthy insulin-producing cells. So while diabetes is a manageable condition now, there is no type 1 diabetes cure as of this moment, but it does seem that there have been advances and that we are inching even closer to perhaps a functional cure and a solution. In the meantime, living a healthy, fulfilling life with diabetes is possible. It hinges on learning and managing your symptoms. And to see what this looks like in practice, you can head to armygymnastics.com and find out more about treating diabetes symptoms.
Thanks for listening. For all things health and fitness, subscribe to our newsletter today. Find out more at armygymnastics.com.